Hello everyone, my name is Katrina Allegra. I'd like to thank you for joining me today. Today I would like to take the opportunity to tell you a little bit about something that's impacted my life. And for any of you dog owners out there, it's something that could impact your life as well. Recently, I took my dog in for a routine checkup. He's an 8-year-old pug. His name is Kike, and he's a very healthy dog, or so I thought. And just a routine, shots, rabies, run-of-the-mill. Every year you have to go. But recently I had noticed a bump on him. And some days it was there and some days it wasn't there, so I wasn't quite sure what it was. Thought maybe it was a cyst or a bug bite. I really had no idea, so I decided to ask the vet about it. So the vet aspirated the bump and looked at the fluid that came out and saw that it was cancer. It was a tumor. I was just devastated. I didn't know what to do, how to make sense of any of it, because my dog seemed perfectly healthy to me. So they told me that it's mast cell cancer, and these mast cell tumors are quite common in dogs. So I decided to do a little bit of research about that to educate myself, and I'd like to pass that education on to you. What are mast cell tumors? Well, we first need to identify what is a mast cell. A mast cell is a cell that normally occurs in your skin and other tissues. The cell is part of the immune system, and it produces histamine, heparin, and proteolytic enzymes. The proteolytic enzymes are enzymes that break down protein. So the histamine, heparin, and proteolytic enzymes are released when the cell is triggered as part of an immune system response in your body. So these cells are there to attack foreign invaders and to take care of us when we're sick. They're supposed to help us, these cells. However, these cells can become cancerous. Tumors develop when the cells multiply improperly and your body, the dog's body does not destroy them. The causes of these tumors are unknown. So there's really not a lot of prevention because we don't know what causes them. But what you can do in your dog is be out on the lookout for the symptoms of mast cell tumors. The most likely symptom is a growth on the dog, like I had with Kike. However, the growth can change size daily, which is part of the struggle that I had because sometimes it was there, sometimes it wasn't there, and I didn't think that it could have been a tumor. At the bump site, there could be swelling or itchiness. My dog didn't display any of these characteristics, but they're known to happen. On a tumor, the most common indicator that it is a mast cell tumor indeed is called a derriere sign. So when the lump is massaged, it may swell or form hives because the histamines are released at this point, and it can turn, it might bruise almost a purplish reddish color as well. Other symptoms of the mast cell tumors may include vomiting, a loss of appetite, diarrhea, and or a bloody stool. But not all dogs will display these. Mine did not. So those are some things that you should be out on the lookout for to determine if it could be a tumor. There is treatment for mast cell tumors. The first step of treatment is actually to surgically remove the entire tumor. And also with this, they will take some healthy tissue surrounding the tumor just in case there are cancerous cells there that are undetected. So they'll take out a good portion of the tissue. Once the tumor is out, they'll send it for some pathology to see at what stage the cancer is. Radiation is often used as a form of treatment. It's more generally used when the tumor is located in a spot that cannot easily be reached through surgery. This could include maybe the paw, because there's not a lot of tissue that you can take out surrounding the tumor. Prednisone is often used to treat the mast cell tumors as well. Prednisone is a corticosteroid which decreases the immune system's response to swelling and allergic reactions. So that would help with the histamine response, which is released by the mast cells in the dogs. Also, in some cases, dogs actually undergo chemotherapy, and this is not always successful with the dogs, but it is another form of treatment. So if the tumors are caught early enough and you follow the proper course of treatment, your dog can live a long and healthy life. My dog has already undergone 2 surgeries. After we removed the first tumors, tumor developed on his tail, and his tail actually was amputated. So that was a hard decision that we had to make, but I'd rather have a pug with no tail than no pug at all. And as this course continues, he's on the prednisone and he's doing great. So hopefully he will have a positive prognosis, and I will have a pug for quite some time. Thank you for your time today.